and welcome to the Shatkin F.I.R.S.T Monday Morning Minute. Good morning, and welcome to today's Monday Morning Minute. We're live here at our May Intro to One Piece Implant training course. As you can see, we have 50 dentists in the classroom behind me from all over the country. We have dentists from California, we have dentists from Florida, all across the East Coast, and we're pumped to learn about One Piece implant techniques. Before we get into Dr. Tharp using the Genoray Papaya cone beam machine and the Triana software, planning an implant case with his patient, I'd like to introduce Dr. James Tharp here in Buffalo, New York.
Hi, I'm Dr. James Tharp. We're here at the Shatkin Learning Center. We're learning how to plan implants on Triana software with the Genoray. You can learn this too. It helps you to make all your implants successful. So here we are. Let's plan this implant for up here. So we're going to put the vertical cross section through there. Oh, this is a tough case. Look at that. Look at how thin the bone is there. So let's go back and forth and see if we can find a place where there is some bone. There. That's about the only place I would ever think of putting an implant. And it's already got a piece of metal stuck in the bone right there. So what do you do here? You take your ruler and you measure. And let's go from, let's say we're going to do a sinus lift here. So you go from a couple millimeters into the sinus down to the bottom of the soft tissue. 11 millimeters is the biggest implant I'd put up there. And then, so what do? You go to your implant library, you hit MDLs, and let's go with an 11 millimeter by 2.5 right there. Okay, hit OK. It comes up with an implant. You take that implant, you spin it around, put it at the angle so that it's pointing down at the central fossa for the lower, and then you put it about 2 millimeters into the sinus. And that's about where I would put that one. And anytime you do that, you have to use a sinus lift kit. And when we do this, we often will sit down with the patient and explain to them why they need an implant and where they need it and how it's going to be placed. And that's why sometimes it's really fun to plan the implant with the patient there.
Hi, I'm Dr. Tharp, and this is Kirby Bannerman. No relation to the Hawks ex-goalie. Anyhow, Kirby came to me about 5 years ago and wanted his teeth to be better. So, Kirby, tell us how you found us.
Well, originally I knew that my lower teeth were in pretty bad shape, and I probably was looking at getting either another denture put in or doing the implants. And I did some research, and I saw some advertisement that you guys had put out in the newspapers. You were fairly close to my home, less than 10 minutes. I called, made an appointment to come in and get an estimate pretty much of what it was all about and how bad things were. That's how I found out about you.
Okay, sounds good. And when you came in, did we do an interview? Did we ask you questions?
Yeah, you did a pretty thorough interview. If I remember right at that time, I think you even did some maybe some x-rays and things like that. You came back and then you said that basically I was in need of a full replacement on the my lower teeth. And you gave me what just a regular denture would cost versus the implants would cost. And then I kind of just went home with all of that because I had to sit back and think about which way I wanted to go. And so then maybe a week or so later, I want to say, I made an appointment with you to say, yeah, let's do it. Okay. And let's do the full implant and go from there.
Okay. So we diagnosed that we were going to take out all his teeth. I think it was 5 or 6 teeth. We placed the implants the same day. We did LPRF, where we took his blood and scraped out the abscess and put in LPRF into the holes. That speeds the healing. Placed the implants, placed the LPRF, and then I think we did a temporary denture too.
That is correct. When I left here, I remember it didn't take that long. I was kind of surprised how quick it actually went. And I left with the temporary in my mouth, and I think you just gave me a prescription for some little mild painkillers. Yeah. Which I don't even think I ever used.
Yeah, normally we would use like Tylenol 3, right. And then we also do antibiotic, either penicillin or some type of an antibiotic. Okay. Okay.
So these are my
So
X-rays from years ago.
these are your X-rays from 5 years ago, and what we're going to do now is we're going to plan to do an implant here and an implant here, which we already did.
Right.
Okay, so we go back from this large zoom-in view to what I call a 3-window view, and then I hold the arrow up here, and then I mouse over the cross-sectional view to where I'm going to put the next implant. Okay, right about there is, I think, where we put it.
I see.
Okay, now we got a nerve here that we have to avoid. That's the nerve that goes to your lips. So then what we do is measure just like a good carpenter. The gums come up to the bottom of that pontic, but we're going to expect a little bit of gum shrinkage as you heal. And so 2 millimeters above the existing bone and not to within 2 millimeters of the teeth. And you see it's 12.86. We're actually going to go to probably a 13 on that one. Go to the implant library, click on it, and there's our choices, and it's already 2013, which is I'm pretty sure what we put in there. And you grab it. Now there's the symbol I want to see. That's the Maltese crassa. And we put it down so that it's in the center of the bone, left to right, with the bottom of the polished collar right at the top of the bone. And then you got 2 millimeters for bone, and then the rest is for the O-ring. Okay, and then we check that on the 3-dimensional view, which I call the skull view. And you look at it at all sorts of different angles. You want these implants to be as parallel as possible. You can see this one and that one are not parallel.
Now I know why they are a little bit different. I always thought about that as I looked at them in my mouth.
Oh yeah. And so you move it over just a little bit. You don't want to get too close to the nerve. It looks like it's on top of the nerve, but it's actually tongue side to it. And then you tip it so that it's parallel to the other implants. Okay? Then we go back to the 3-screen view on top here. And then we're going to move the cross-sectional line further back to right about there, in between that old molar and the second bi, and measure again. You can see where the nerve is. In fact, let's do this on a bigger screen, because I can.
I can imagine if you did hit the nerve, people are definitely going to
Well,
feel that.
that's why when you do this, you numb up on the outside, not so that the nerve gets numb. In other words,
Right.
If I'm taking out teeth without having to put implants in, I'll numb way in the back where the nerve goes into the bone, and that gets everything numb, including your lip. When we do placement of implants, we don't want your lip numb, because the outside of the bone has nerves, the inside of the jawbone has nerves, but in the middle of the bone, there is no nerves. So except for the one going through. And so what we do is then we plan it so that you place the implant, and this is going to be a 13 again. And let's get the right symbol. There's the symbol for bodily movement. It looks like a little Maltese cross, and you put it so that the bottom of the polished collar is right even with the top of the crest of the ridge, and that is probably where we place that one. You can see it's still about 2 millimeters away from the nerve. In fact, let's measure that, just because I can. There to there, 2.3 millimeters. That's perfect. Okay, so now I'm going to go back out of the big screen to this screen, and then go to the skull view, and we can see we want to tilt it forward some, and that's about parallel. And let's look at it from this angle. You can see it's not near the nerve, and from the bottom angle you can see it's not near the nerve, and that's what we expect. Yeah. Okay, now let's cheat. I'm going to bring this back to where it was from the start. And here's something I always do. I take the labels of what size implants I've diagnosed to use, and I bring them down so you can see them. And then I take a picture of that with my cell phone so that I have a reference, because every so once in a while the computer will eat my homework. And so
That problem too, huh?
yeah, and so I want to save that, and so when I take that picture, I'll take it so it has your name, and it has the skull view on it, and it has the labels for the implants and where they're at.
Gotcha.
And that little view from there to there gives me all the information I knew to do the job right, just in case the computer eats my homework. So here's what usually happens. You hit the close button, and it says, do you want to save it? And I hit OK, and then it comes back out to here. Now, let's go right to this view. There's our finished view. That was the same day we took the teeth out.
Mm-hmm. I remember that.
Yeah, and then we placed that. Now, what can we do to double check this? Well, let's go to the 3D view again. Make it, in order to manipulate the screen, you have to have it on 3D. So you hit this little green square, okay? And then if I want to make this larger, I'll go to here, and there it is. And that's where we placed all those implants, just like we had planned after all the teeth came out. So what happened next? Do you remember?
Well, I just went home. I think we just waited. I don't remember how long.
Usually it's about 6 weeks.
Yeah, I was going to say something like that. The swelling went down pretty much right away. I didn't have any problems at all. Didn't have really a lot of pain, like I said.
Mm-hmm.
A little irritation here and there, maybe when I was eating at times. But that first 6 weeks until you got the replacement, it was fine. I had no real issues at all.
Okay.
And then I waited for you guys to give me the call and say, come on in, we've got you ready.
Yep. So we examined him, determined that his healing was adequate for doing impressions. We did final impressions for the denture with implants. Sent it off to, I like to use Lord's or Shatkin. I don't remember which one I actually used. And then proceeded to do a try-in where we had everything fit and ready to go, and except the teeth were in wax. And that way we could move it around, get the occlusion finalized, and if any of the teeth needed to be moved, move them. And then 3 weeks after that, we had the final. We placed the final, picked up the housings, the O-ring housings. And do you remember if there was any changes from the temporary denture to the final?
No, truthfully, do I remember, going back 5 years now, I remember that the final fit tighter.
Yes.
And which actually I preferred it that way because there was really nothing loose or anything like that. No food was getting underneath the plate, and it worked out pretty good. That's what I remember the most out of it.
Okay.
And at the very beginning, I remember saying it was very difficult, not difficult, but it was tight. It was tough to get out because they were so tight.
Yeah, we had to work on how to get it in and out.
Yeah, right. Getting used to it, I guess.
Okay, and then so after that, we saw you every 6 months.
Correct.
And usually on a 6-month check, we check for sore spots. We check to see if there's any O-rings worn out. Can you remember how many times we've had to change O-rings?
Once, maybe twice.
Maybe twice in 5 years.
Yeah.
That's pretty good. This last checkup, we didn't have to
We didn't do anything, correct.
It was great.
Right.
It was great.
Yeah.
And you're able to eat?
Yes.
Okay.
Pretty much everything.
Okay. What can't you eat? What can't you eat?
I mean, the corn on the cob and things like that, and I don't know that that's much for the lower as the upper denture.
Yeah.
But other than that, no, I've had no problem. I can't think of anything that gives me problems or issues.
Okay.
Yeah.
Good.
Works out pretty good.
Good. It was expensive. There's no two
A little
ways
bit,
about
and that
it.
was one of the things, as I talked with the wife and everything else going forward. I had just retired, and looking forward to that. And the cost was something we had to think, is this worth it? And I can say that after 5 years, yeah, I think it's very much worth it. I know a lot of people that have just gone, because I have upper plate.
And it's just a regular upper
And it's just a
plate.
regular
Right.
one. And then when they get both the lower, how much difficulty they have eating,
Mm-hmm.
on the plates. And I didn't want to go through that.
Mm-hmm.
So in the long run, yes, anybody that tells me now, I always recommend to get the implants
Yeah.
in.
Lower is a
Versus
definite.
Yeah.
Upper is optional.
I think we talked about that.
Yeah, I
You
think
gave
we
me-
did.
Yeah,
Yeah.
because I
And,
had that concern.
Right. And if that upper gets loose again, then you have to make a decision. Do we remake it? Do we do a reline? Do we do implants?
Right.
And those are the
And we
three
just talked about
choices.
that the other day.
Yeah. So I think that's about it. Anything else you wanted to say? Would you do it again?
Sure, I would. And as I said, I've also recommended it to other people. In fact, I've recommended you to a couple other people, but they just didn't want to do it.
Well, you've had, I think, one or two come.
Did they?
Yeah,
Okay, yeah. And so I've done that. A couple of minor issues over the years, but you've been taking care of those right away. But nothing that I can really complain about. And that's why I'm sitting here right now.
Good, and I
So
appreciate
I want to say,
it.
I think you guys have done a great job. Your help's done a great job. You've done a great job.
I appreciate it.
And,
Thank you much, Kirby.
Not a problem, Doctor. Thank you.
I appreciate it.
All right.
Thank you.
Take care.